position basically means that you want to bring the bed, okay, while the patient lying on it, but your leg is go higher than your heart. Why you want to do that?
Because you want your blood rush into the heart.
Yes,
Yes.
correct. So there's some patients that require that. So with a press of a button, you can also bring it them to the vascular position as well. Okay. So if you want to bring it out again, let me show you. Okay. You can go down. So for example, some patients they want to be in like a chair or semi-chair position. You can adjust this to go down. So when you go down, what's the benefit of this also? So it's same like when we're doing in the mattress, right? Some of our mattress. Why the heel is softer? Because we want to distribute out the pressure from the heel to the calf. So while you are doing this, right, the heel is slightly lifted up. So the one that is in contact with the mattress, okay, will be your shin here. Yeah. So that's why it will be distributed out the pressure onto the leg here. Okay, so this is also very important, or else you can bring it back. Yeah. Okay. So same, if you want, you can press the supine position. Okay, flatten out, bring this up for the heels. Okay, this is the knee. Okay, so let's bring the bed higher. So there's two features over here. Okay, this is the max inflate, meaning if I press this, once it's turned green, it will fully inflate the mattress, make it to the highest pressure. Okay,
Highest,
so it's become hard.
Heart, yes.
Yeah. Okay, so usually when you do CPR at least, you need to have these features. Okay. So if you press this, okay, this is called side exit assist. Okay, so as you can see, if you look at over here, right, you see as the person is sitting down, the center here, okay, is in blue color. So what does it mean? Meaning the center part, right, okay, will become slightly softer, so that to allow the patient to exit, easier exit from the bed. Okay, so that's called a side exit assist.
Does the side become softer or harder?
No, the center part, the sitting part will become softer, but the side is still continue to be hard.
Yeah, I see.
Yeah, so that again, same like the NP100, right? The side, it need to be firm to assist them. Okay. So moving on to here. Okay, we have the knee down, knee up. Next we have is like the bush features. Okay, you press the bush and continue. Okay, you see you go down. So now when you press the bush, right, this one is automatically activated. Okay, because it need to be at the most firm, as hard as possible. Okay, and then you can see that the bed is currently doing the trendy Lambert position by itself. Okay, so it's a 2-in-1 features, 3-in-1 in fact. Sorry. Yeah, lower the bed. One thing. Second thing, tilt the bed. Okay, to trendy Lambert. Two. Third thing, it also make the mattress as hard as possible, so that you can move the patient down. Okay, because if you have a heavy patient, it's very difficult. In this current position, you can just come to the head, okay, assist the patient to pull them down. Yeah, that will be easier for them. Okay, and you need less hassles because it's a downward force. Okay, so next you can bring it back also. Okay, so now it's still activated. You press again, it will off. Once it's off, meaning it will go back to the weight adjustment. Okay, it will move according to the pressure in the mattress. It will change according to the patient body weight as well as their movement. Okay, bring it up again. Okay, so same, you have the trend and reverse trend buttons over here. If you want to leg down, you can, and it show you reverse trend. Okay, if you want to trend, you can also. Yep, level. See, now it's trend, so you know it's currently in trendy level. Then you can flatten it. There you go. So it's 0. Okay. Next is these two buttons. This is what we call the flex a foot that I mentioned to you just now. This is to adjust the bed length. Okay. So of course, if you press this, I'm not sure whether it's the most. Okay, it's longest. Okay. If you shorten it, it will auto shorten. So for this, right, it's an integrated mattress. So when you shorten it, the mattress will become shorter also. Okay. If you lengthen it, the mattress will follow. Okay. So that's why over here, inside here, right, it's actually very soft. So when you extend it or shorten it, it won't affect. It won't change also. It will follow the direction. Okay. So one very important features that we have based on this flex a foot is also you can use this to exercise the patient. Okay, so what does it mean? Okay, so usually when a patient lying on this, maybe let me show it to you. Okay, so normally in the ICU, for example, when a patient lie on it, they are immobile. Correct? Back to my slides earlier, if the patient is immobile, the muscle is lost. So the physiotherapists, when they come, they need to exercise, move the patient body to gain back the muscle. Okay, so what they do usually, for example, in the leg, if they are in the bed, right? Okay. If patient in the bed, what they do is they will hold their leg, move them up and down, flex it. Okay, like this, up and down. Okay, so it's exercise, pull the veins as well as the muscles to exercise. But with this, you don't need. Okay, you don't even need to do anything. You can just shorten it. Okay, put the patient leg firmly on the footboard. Okay, so you can shorten it. So when you shorten it, it's actually push it back to exercise your muscles. Okay, later on you all can try on it as well. So you lengthen it, then you'll release the pressure on the muscles, and then you push back again. Okay, you push you back to exercise your muscles, and then you press this, you release again. Okay, so this is the additional features that just a basic normal flex a foot features that can help you to exercise the patient body muscles. Okay, so this you can do again. Remember when I said about the progressive mobility program, right? First thing, you want the patient to be able to breathe. Okay, breathe actually just keep the patient alive, so they are able to breathe. Okay, so second one, we want to tilt. Tilt basically is the trend and reverse trend function. You can tilt them. Okay, after that, you can sit them up if you want with the easy chair function. Okay.
Can we do easy chair?
Of course, yeah, I will go through this one in a moment. But with this, it will be kind of the first step. During the breathing staging, you already, without touching on the patient even, you can already do the exercise for their legs muscles just by pressing these two buttons. Okay, our competitor also have, like Striker, they have this flex a foot similar extending electric model. Okay, but they didn't have the knowledge that they actually can use that to exercise the patient's body muscles also. Yeah. So for us, we know that, we notify that, so we want to show it to the customers as well to let them know that, hey, since you have this, you don't even need to use the therapist or physio to lift up, because again, we always cater for extreme cases. If you have a very heavy patient, you want to lift up the leg, to move them is really very difficult. Once you have the button, why you want to do that? You can just at the press of the button, you move by itself already. Yeah. Okay? Okay. So now that is about the buttons on the outer layer. I'll go through the GCI later on. Okay? So on the inner side, both is the same. Okay? As you can see, this is of course the backrest. Okay. And then at the knee section as well, if you want to go up and go down. Okay, knee section.
I think it's moving faster than the SLR, right?
Slightly faster.
Yeah.
Yes, correct. Then at the center here, like the nurse, okay, this is just the nurse call button. Okay, this is the additional function or features that you can choose with or without the bed to come with it. Yeah. Okay. So of course, if you connected to the 37 pin, to the EMR system, to the nurse call, then this will be helpful. Whenever they need, they can just press on it to activate the nurse call. Same like the small button here. Okay, you can press. Okay. Then the rest of the panel, as you can see, is those special features that even now, like I mentioned to Acela, we never use it in Affinity 4. You can control the ceiling light. You can open a book reading lighting, TV. You can change channel volume. You can change, but yeah, again, nobody is using it anyway. Just to share the actual fact here, nobody is using it. Yeah, but it's good. It is there if you need it. It has been there for more than 10 plus years, but yeah, nobody's using it. So okay, so that's all about the button. The last button that I want to show, of course, is the chair features. So for the chair, which way should I do it? Okay. So I just remove this. Okay, so for the chair button, is actually if you don't choose the 885, the highest model, it won't have the patient egress system, so it'll be like a dining chair. So dining chair will be similar to Acela, the easy chair features, but this one again is the highest model, so it have a features that what we call the patient egress. That is the final move that we want to move on for our progressive mobility program as well. How it works, let me just show you. Okay, so while honing on it, you can see that on the GCI it's already told you, okay, watch drainage device, for chair egress remove footboard. So right now it's telling you that I'm moving towards the chair egress position. Watch out for drainage device, because sometimes if user didn't know, they might hang here because there's a place for them to put their drainage or anything, right? So they might put there, so while the bed is moving, it might cause the drainage to leak or anything. So it's not recommended. That's why I mentioned we want to put it here on the green color hook.
Yeah.
Okay, so next is also C, for chair egress remove footboard. No problem, if I don't remove it, you can continue to press, but when it's reached the limit that it can go to, it will also give you a prompt. So if you want to know now how far away to the chair egress features, okay, you can see that it is moving the bar. When it's reached the end, of course, meaning it is already at the chair egress position. Okay, so right now it shows remove footboard. Okay, so however I press, cannot.
Yeah.
Okay, so what you need to do,
Remove.
yes, remove the footboard. Okay,
Chair pattern.
once I remove,
Push the chair button.
push chair button. So this is the chair button. So I continue to press. It will move. I will show it first. Later on, you all can sit on it and to try. Okay. See? Sit deflating. Release chair button until beep. So right now I don't need to press already. So this part is currently deflating the seat. Okay. Why we want to deflate it? Okay, because if inflate, right now there's no angle on the bed. There's a risk patient might be sliding downward. So that's why you need to deflate the seat. Okay, so patient is safely seated inside the mattress itself. Okay, so while it's deflating, no need to do anything. Wait until it shows the beep sound. So while waiting for it, you can hear the sound of the thumb moving, right? Yeah, so this is an older model, it's more noisier.
Yeah.
We receive a lot of complaints, I would say, the feedback in a good way, that the noise is quite huge, especially in the ICU because it's a closed area. Yeah, so right now the model, there is a noise, but it's much lesser compared to the current one that you are listening to right now.
So they don't use the pump anymore?
They use the pump, but they somehow use the, I would say, the noise cancellation kind of things to reduce the noises. Yeah, to reduce, but it's not completely removed. Yes. Okay. So now, for best egress, push chair button to tilt. So you see the line is not final yet, so meaning I can still move some more. Okay. So let me push this. So as you can see right now, you see the foot end is already almost reaching the floor.
Yeah.
Okay, so this, if your leg is here, how far away you are on the floor? Usually you are on the chair, on the bed, you can only exit sideways. Correct? But with this, the patient no need to tilt, no need to anything. Okay? The patient will be actually like sitting in an actual chair position already. And they can come out from the front like this. Okay? Usually they are sitting like this, right? They can come out from the front directly like a king or a queen. Okay, so that is the best features. These unique features is what only Huron have to offer in the market. No one have these features. So this is the final position, because in the ICU, again, limited space. You can't move around too much. So what you can do is with this position, okay, similar to what we do for Acela yesterday, right? In order to assist the patient to sit up, you can bring the rollator or a mobile hoist that we have over there, Lico, to put it on the patient to help them to stand up also.
Can you lift this, right?
Of course.
Why sitting like when you said to me before?
Of course.
Like, can you lift the
Of course. You see now? Right?
Oh, I see. So similar to this.
Yes, correct.
Very similar.
But this one is you can come up directly from the front. You don't even need to turn the patient to the side way. Because over there to Acela, again, if you are sitting sideways over here, right? If the patient is weak, okay, they might fall back, fall to the side, or anything. Okay, but for this, it's okay. They are safely on the bed.
Yes.
Yeah. So while you are pushing up,
Yes.
okay, they can come out. Of course, you just stand in front to assist them. Okay, so this is the most unique or the most important features that our Progressa have. This is definitely a killer features that we have. So even if you didn't go through the full extent of the chair egress, right? From just now, you see, you bring it, the backrest, the knee. With that press of button, it also help you to exercise the patient muscle. As long as you move your body, meaning you're exercising your muscles. So as much as possible, without doing anything, the nurses can come inside the ward, press the button, okay, to flatten it, and then press the chair again to reposition them to exercise the patient body muscles. Yeah. Okay, so that is very, very important. See? So while you are pressing on it, right, to bring it to the flat or supine position, okay, it will tell you also, press and hold bed flat button. Anything you do, the screen will give you instruction also to teach you how to use it. Okay? Okay, wait for surface to inflate. So right now, because it's deflated, okay, no air, so it need to be inflated, and then if you continue to press, then it will to go back. So it's recommend you to put back the footboard, okay, any other articulation available. So you have anything like monitor, anything that you want to put back, you can put back now as well, while we are waiting for the mattress to be inflated. Okay, so right now if you want, you can put back the footboard. Yeah, you can put it back. Okay. So once it's turned like this, meaning it's inflated enough, you can continue to press. The bed is going down. Okay, I will stop here first. Next features that I want to show you is CPR. So as you can see for CPR, right, for all the rest of the bed, okay, is at the head end, and it only lower the backrest. Okay, for Progressa, okay, it will flatten the bed, including the foot. Okay, both.